Good day. It's certainly a pleasure to be back with you on the Healthbeat Show. I'm Dr. Jeffrey Watson, and welcome to the Healthbeat Show.
You don't have to take my word, but I heard if you have your health, you have everything. Take my word, but I heard about the health beat you're gonna be. How do you wanna be? Show me how you will be. How do you wanna be? Show me how you will be. Listen to the show, the more you'll know about your health.
And welcome to this week's version of the Healthbeat Show. I'm Dr. Jeffrey Watson, and with me today we have a very wonderful young physician in none other than Dr. Marcia Redwood. Welcome to the Healthbeat Show, Dr. Redwood.
Hi, Dr. Watson. How are you?
I'm fine. And we're so honored that you would be with us. Dr. Redwood is a new, young internal medicine doctor practicing in the community. And tell us where you're practicing now.
I'm practicing at Watson Wellness Center, located on 5709 Market Street in Oakland, California.
Okay, and we feel very positive about having Dr. Redwood. We also have Dr. Snipes. We have a PA in Omar Staples, and we're really looking towards taking care of those with disparities in disease. Basically, those with high blood pressure, diabetes, HIV, women's care, seniors care. Tell us a little bit about where you are from and where you did your training.
Well, where I'm from is a little more complicated than the average person. So my parents are in the military. I was born in Oklahoma. I moved to California when I was 5, and then I moved to Germany when I was around 8, and then I moved to D.C. around 12, and then I went to high school and college in Maryland, and I went to medical school in Virginia. And then I trained at Highland Internal Medicine for primary care.
So you've seen a lot.
Yes, I have.
You are well traveled. And coming from Highland Hospital's residency program, I mean, that's a pretty dynamic program. And what types of patients do you generally see, or did you generally see in your residency program?
Well, we generally saw a very large, diverse patient population, ranging from 21 years old all the way up to, 102 years old. We saw patients that range from just one problem, maybe like high blood pressure, to patients who had a lot of issues going on straight out of the hospital, straight out of surgery. So we see a large gamut.
And in your training, you not only saw people in the hospital, but also in the clinic.
Exactly. We saw patients in the clinic, and we would follow them from the hospital once they got discharged, and then we would obtain them in our practice and become their primary care docs.
So you really have a good understanding then of what primary care is about. It's
Definitely.
Not just hospital training.
Definitely. We're trying to encompass all of the specialties that the patient has to see, rather than like heart doctor, they have to see their lung doctor, they have to see their womanly gynecology doctor, and the primary care doctors are trying to coordinate all of those different specialists in terms of getting that patient the best care that possible.
And being an internal medicine doctor, you are actually capable of doing a lot of the things that a heart doctor or stomach doctor or a gynecologist could actually do. Is that correct?
Exactly, and that's where we're trained at Highland Internal Medicine, and they trained us very well to do that. And so we're trained to take on a lot of responsibilities that the specialists can do for these patients, and so we don't really have to refer them per se, but we can actually take care of all of those issues as a primary care doc.
Now, we're very proud that Dr. Redwood has joined us at the James A. Watson Wellness Center. When did you start at the James A. Watson Wellness Center?
I joined in November 1st, 2010.
All right. And being a female physician, you know, it seems like now there are a lot of females who are going into medicine. It used to be kind of like nursing, but now there are a lot of women doctors. What are the areas of interest that you have in providing health care to the community?
Well, the areas of interest I have in providing care to the community are women's health and HIV medicine.
And did you do any kind of special training in any of those areas?
I trained in specifically HIV medicine at Highland Internal Medicine Program in primary care, and we would have a clinic once a week where we would see patients on our own in the HIV clinic. Women's health is a little different. I didn't really see a lot of women's primary care, but however, the internal medicine primary care program taught us how to treat women as best as we could.
Okay, and now when we talk about HIV and we talk about women's health care, I mean, this is a issue that is really becoming more pertinent for women. When we first talked about HIV and AIDS, we talked about gay men.
Right.
And is that now still where the emerging population is coming from in terms of new cases of HIV disease?
Well, still we have that subpopulation that's emerging with new HIV cases, but mostly new HIV cases are coming from women who are straight. Unfortunately, black women are 15 times more likely to get diagnosed with HIV compared to the white woman, and 6 times more likely than black men to get diagnosed with HIV, according to the CDC.
Well, why is that? I mean, why would that be?
There's a lot of different reasons, and we really can't really pinpoint that reason. But there's a lot of different theories in terms of, we really can't pinpoint that.
Mm-hmm. And I guess this is a big issue because you've got a lot of African American males who've been in the penile system.
Yes.
And there's some things transmitted there. And then you probably have people who come out, they've been exposed to sexually transmitted disease in jail, and then what are they going to say when they get out? They're not going to say, well, I did this with another man. I mean, that's probably one area that it comes from.
Yeah, that's one area, but there's so many different issues. I mean, the biggest issue is just education. A lot of women don't realize that they can get HIV, and a lot of black women feel that HIV is a gay black male disease, and therefore they're not as likely as black men to get it, and so therefore they're the ones that are getting more and more diagnosed just because of lack of education and counseling.
Okay, we are here with Dr. Marcia Redwood. We're very honored she has started to work with us at the James A. Watson Wellness Center. We're talking about all the types of things that she knows how to do: women's health care, cardiovascular disease, HIV disease, diabetes, all those types of things. Stay tuned, and we'll be right back right here on the Healthbeat Show. I'm Dr. Jeffrey Watson. We're right here at 24 Hour Fitness. We are here with Coach Keith and with none other than the lovely Miss Shamir Washington. And today we're going to learn about how to get that, how do you call it, Shamir? The bootay. We're going to get the bootay strong today. So call everybody in, tell them to get ready. Coach, tell us how to do it.
Awesome. Well, we've hit on the abs. It's time for us to get some balance going. Go ahead and roll over on your stomach, guys. Good. Whenever you work your abs, you always want to also work your lower back. So put your hands down by your sides, palms facing up. Relax your face on the mat. Take a deep breath in, exhale and relax. And you want to gently lift your shoulders off the ground. Do not jerk. Exactly. 1. Perfect.
Well, that's good. I can feel that in the
2.
lower back.
Perfect. 3. Good. 4. If you feel any discomfort in doing this exercise, stop. Good.
All right, you
5.
can do this at home.
Yes, you can. 6. Nice and strong. 7. Remember to breathe. 8.
There you go.
9. And 10.
All right.
Good. Go ahead and roll over. We're going to fire up those What you guys call it?
The bootay.
The bootay.
Yeah.
All right. Good.
My
Good.
bootay strong.
Good. This is for the trophy here, guys. Go ahead and lift those hips off the ground. Nice and strong. Take a deep breath in first. Exhale and relax. A little bit higher. A little bit higher. Get it up. Get it up. Perfect. And pelvic tilt. 1, 2, higher. 3, higher. 4. Nice and strong. 5.
I see what you're talking about.
6. Good. 7, 8, 9, 10. Hold it up.
Okay.
Deep breath in.
I
Exhale
can
and relax.
feel it in
Open
the
and close
bootay.
your inner thighs. A little higher, Shamir. 1, 2, 3, 4, 5, 6. Come on, nice and strong. 8, 9, 10. Excellent, Doc. Keep it up. We're going to combine it all together.
Okay.
Pelvic tilt and open and close. And go. 1. Good. 2.
Oh, yeah.
3. Perfect. 4.
That's
Nice.
good for the
5.
behind.
Good.
Oh,
6.
it's burning.
7.
It's
Good.
burning.
8, 9, and 10. And relax your hips.
Oh.
Deep breath in. Exhale and go ahead and roll over on your stomach.
That's a good gluteal exercise coming from the
We're
coach.
not done. We're not done. We're gonna fire. We're gonna keep them on fire.
Okay.
We're gonna tone and shape those glutes nice. Relax your face on your hands. Bring your legs into a 90-degree angle. Heels together, toes turned out. You're gonna relax your upper body. Take a deep breath in. Squeeze the glutes and lift your knees off the ground. Perfect. 1, 2. Good. Lift. 3. Good job. 4. 5, 6, good. Finish strong. 7, 1, come on. 8, that's it. 9, and 10, and relax.
All right. All right, well, there you have it from the coach. We've learned some about how to get those glutes going, that behind, that bootay. We've been talking about sit-ups, about the core of the abdomen. You can do this at home. We've enjoyed it right here on Fitness Facts. Stay tuned for the Healthbeat Show. I'm Dr. Jeffrey Watson here with Miss Shamir and with the coach. We're right back here on the Healthbeat Show. I'm Dr. Jeffrey Watson. Joining me is none other than one of the newest physicians in the community, Dr. Marcia Redwood. Dr. Marcia Redwood is an internist, just finished her training at Highland, and is working in the community at the James A. Watson Wellness Center, providing health care to those who need it the most. Now, we were talking just briefly about HIV disease, and we were saying that African American women, you said, are 50 times more likely to...
15 times more likely.
15 times
15 times more likely to get diagnosed with HIV.
And we're trying to figure out some of the reasons. I guess IV drug abuse could be,
That's a big,
using needles.
That's
could be
another
one
issue.
cause.
That's another issue.
And you said education and learning that it is a sexually transmitted disease. We talked some about the fact that maybe their partners could have been in a situation like in prison, may have had a sexual encounter that resulted in transmission. Now, you've seen all on television and in books and in, all the big TV shows, they talk about this situation of the down low, about men on the down low. I mean, what is that all about? What's your thought about that? Do you even have to address that to deal with HIV, or is it just, I'm just going to deal with the disease? I mean, that's part of the education. Should you be asking what one's sexuality is about?
Well, as primary care docs, we're obligated to ask about people's sexual orientation, and so therefore they are obligated to tell us the truth about whether they have slept with men, slept with women, or what their sexual orientation is exactly.
How often should a person get an HIV test, and who should get an HIV test?
So obviously the HIV test should be given yearly, and everyone should be getting HIV tests, regardless whether you're
grandma, grandpa,
grandmas, grandpas. Yeah, there's actually a new demographic population, and that is the elderly population that is getting AIDS. Actually.
Now, do you think? Now, here's another factor that I think needs to come out too. What about the invention of the PD5 inhibitors, the Viagras and the Levitra and all that kind of stuff. Here you have men that, you know, maybe they weren't as sexually active in their later years in life, but now that they've got these erectile dysfunction medications, do you think that has played a role?
I'm sure it does. I'm really sure it does have play a role in it.
I've had female providers even say to me that they don't want to prescribe those to men because they think they increase
It's going to contribute to the HIV epidemic.
But do you think that has anything to do with why some seniors might be getting HIV?
Yeah, I think that's a big cause right there.
That's associated with them being able to be more
sexually active right now, so therefore they're able to get all the STDs that the young people can get.
Okay. We're talking right here with Dr. Marcia Redwood. We're talking about some of the things that she trained in Highland. What about the other things in terms of women's health care? We're very honored that we have a woman physician with us. And what are the kinds of tests that a woman should get during a regular checkup or during their yearly exam or even just periodically during the year?
So it depends on their age. So according to the guidelines, any woman after 40 years old should get a yearly mammogram, and any woman past 18 years old, or if they become sexually promiscuous in their teens, they should be getting a yearly pap smear.
Okay. How about, do you think women should get heart tests? You know, when I was in my training, they said that heart attacks were just men mainly had them. Do you think a woman should have an exercise stress test or should have their heart checked?
Yeah, exactly. I think after menopause, I think women are just as likely as men to get cardiovascular events.
So they should, you know, whereas before you just had the husband getting the test, now the wife or the woman should be getting the test.
Getting an exercise stress test, baseline EKG, and all the other risk stratification tests that we do.
And then what about things like colon tests? They should.
Oh, definitely. So after 50 years old, we're supposed to, everyone should be getting a colonoscopy every 10 years.
So mammograms past the age of 40. Heart tests in a woman. Colon tests past the age of 50.
Exactly.
And pap smears beginning either at 18 or when they become
sexually active.
Those would be the key things. And are there any new things that we should be... What about this HPV situation where people are talking about genital warts on the cervix? Is that something you can just get routinely tested in a pap smear, or do you have to kind of have some more special testing?
So yeah, you can get routinely tested for that on the pap smear, but there are different strains for HPV that causes or it has a bigger risk factor to getting cervical cancer, and we do test for that on the pap smear. Basically that's it.
So that's the human papilloma virus. That's what we're talking about. We're right here with Dr. Marcia Redwood. She is one of the emerging young physicians that is going to really lead our community into the new healthcare system. And we'll be talking a little bit about that. So stay tuned and we'll be right back.
Have a good night and rest easy.
Are you tired, sleepy, depressed, snore a lot, sleep a lot during the daytime? Do you have high blood pressure, diabetes, or suffer from sexual dysfunction? You may be suffering from sleep apnea. Talk to your doctor and contact the James A. Watson Wellness Center Sleep Clinic. Remember, we want you to have a good night and rest easy. Give us a call today at 510-444-8627. Remember, that's 510-444-8627, and you'll rest easy.
Victory is mine. Victory is mine. Victory today is mine. I told Get thee behind, 'cause victory today is mine.
All right, beautiful, beautiful. We're here with Miss Tranisha Golston from the 5-A-Day campaign that tells you to eat 5 fruits and vegetables every day.
Right, that's right.
Because that's the key to our health. Now, we have some fruits and vegetables. What can you tell us about the seasonal guide to fruits and vegetables?
Okay, well, if you're on a budget, it's always best to purchase fruits and vegetables when they're in season. And I just wanted to point out a couple of our informational brochures that the state provides us with. And for example, in the spring, we're looking at between April and June, you'll find bananas, apricots, eggplants, these types of things that are in season. And say for example in the summer, July through September, you have chives, you have scallions, you have onions, you have blackberries. And I want to point something out on here too. Now this is a seasonal guide for fruits and vegetables for fall, October through December. We're looking at bok choy, we're looking at broccoli. And in the wintertime, between January and March, we're looking at collard greens, which we have here on our lovely display. We're looking at mustard greens, kiwi fruit, tomatoes, and even red apples.
And that's when they grow or are most available during those seasons?
Yes, that's when they are in season, that's when they grow. And if you're on a budget, as most of us are, that's when it's best to purchase them. So you can make sure you have your 5 to 9 servings of fruits and vegetables.
And so what you're saying is that all year around, these fruits and vegetables, and a variety of them, are available to us.
That is correct.
No excuse not to get your good fruits and vegetables. That's what it's all about. Right here on Down Home Healthy Cooking on the Healthbeat Show. Eat your fruits and vegetables. They're good for you. The victory will be yours. I'm Dr. Jeffrey Watson, and welcome back to the Healthbeat Show. We are talking with one of the emerging physician leaders in our community, and none other than Dr. Marcia Redwood. Dr. Redwood has just finished her training at Highland, where she has seen a broad spectrum of disorders, everything from women's healthcare issues to HIV, and HIV in women.
Right.
Kind of almost like a subspecialty area, but a very, very important area. We're talking about mammograms, pap smears, human papillomavirus, women getting heart testing, and colon testing as well. Now, what about a young woman getting birth control nowadays? You know, when I first started practice, the pill was pretty much the big thing.
Yeah.
Is the pill still the #1 form of birth control? Is it exclusive in itself? You need to do condoms and the pill? What do you suggest to women?
What do I suggest? I suggest it all depends on what they feel and what they feel comfortable with. Luckily, compared to when you were practicing, there's a lot more different methods.
I'm still practicing. When I first trained.
When you first started. When you first started, there's a lot more different ways. There's a Mirena, which is an IUD. It's not as bad, or it does not cause as much cramping as a copper IUD. There's seasonal, which is a birth control where you get periods every 3 months, and there's the regular other birth control pills where you get periods every month.
That's a kind of a birth control pill that you just described?
Seasonal is a birth control pill, yes.
Okay.
And also there's NuvaRing, there's all kinds of things that are advertised on TV. But I suggest that if a woman is feeling comfortable in their relationship and they're feeling that there is a relationship that's monogamous, I don't feel that there's a need to use condoms. Condoms are usually used to prevent STDs. So if a patient of mine who is on birth control pill and they feel that they're not in a monogamous relationship, then I suggest that they use condoms.
Okay, so if they're not in a monogamous relationship and they're trying to use birth control, use the condom. Should they use the condom and the pill, or just?
I suggest use a birth control pill and a condom, because sometimes condoms are not as effective as a birth control pill.
Now, you didn't say that if the woman is not monogamous because it's not always just a man.
Well, if that's the case, they need to use a condom in the first place, too.
Okay. So ladies should carry their condoms with them too. That's a safe
Definitely.
thing. And no love without the glove.
No love without the glove. That is for sure.
We're here with Dr. Marcia Redwood. We're talking about women's health. We're talking some about STDs. But definitely women have cardiovascular disease, strokes. What about this whole thing? You know, we used to tell all the women to take estrogen replacement. So for hot flashes and to prevent hot flashes and all that, is it still safe to do that, to take the estrogen replacement? What's your general thought about what you're telling women these days?
So it's not a guideline to use estrogen replacement for patients who are postmenopausal because estrogen can cause is a big risk factor to getting a lot of cardiovascular events. I suggest if they're having hot flashes, they can use actually a herbal medicine called black cohosh, and that is actually FDA approved for hot flashes.
Black cohosh, and that really works?
Yeah, it does.
It does? What about licorice and some of the other types of, is there anything else that really works?
I have never heard of licorice being used for hot flashes.
I've heard of women saying that they were using those kinds of things. Okay, well let's see, what are the take-home messages for 2011 that you would like to tell the ladies so that they could be healthy for the upcoming year within the new healthcare system? Because we're saying that people are supposed to be able to get all the major tests within the new healthcare system. What would you recommend that all the ladies look at
So
getting?
all the ladies should be getting pap smears regularly. All the ladies should be getting mammograms yearly after 40 years old. All the ladies should be getting heart screening tests after 50 or after their menopause. And all the ladies should be getting colonoscopies as well. And love yourself. That's all I got to say.
Love yourself. Well, I think you have it right there from Dr. Marcia Redwood. You can find Dr. Marcia Redwood in the office at the James A. Watson Wellness Center, practicing with Dr. Tyrone Snipes and Dr. Watson. She will be on staff at Alta Bates and Summit, and we try to make it a real emphasis to go see the patients, because I think that's a key thing when we do have patients in the hospital. And we really appreciate you being with us.
Thank you, Dr.
Redwood.
Watson.
And we look forward to all of the information that you're going to give out to the community and the leadership that you bring, particularly in the areas of female health care and HIV.
Exactly.
All right, I'm Dr. Jeffrey Watson. We're right here on the Healthbeat Show. Remember always that your health is your wealth, and if you knew better, you could do better. We'll see you next time. God bless.